having a bit of a further look at lower limb neural anatomy, something that's really important, particularly with our vallex points, but more broadly, we just need to know where those nerve pathways are and where they bifurcate, so that we can, really make sure that we're treating in the correct spots. But of course, this is going to help with our diagnosis, and our further management becomes easier with this as well. Let's have a bit of a look at the video so that we can refamiliarize ourselves with those nerve pathways. Let's start on the lateral aspect of our lower leg and our foot with the sural nerve. Sural nerve's coming down just posterior to that lateral malleolus before it becomes inferior. Now, just above that lateral malleolus, it is going to bifurcate into our lateral calcaneal nerves. Following this, there will be different communications, and you'll see with a lot of the different nerves on here that I've put a lot of the other different communicating nerves there. That's just going to help us a little bit later on. Coming back to the sural, after we've gone inferior of that lateral malleolus, we'll be passing around that styloid process before providing innervation into our lateral fifth toe. As we start to become medial, we're going to be talking about our superficial peroneal nerve. There's a bifurcation just above the ankle into our intermediate and our medial dorsal cutaneous nerves. Now, our intermediate cutaneous nerves are going to be innervating through to the medial fifth and the lateral fourth toes, as well as through to the medial fourth and the lateral third there as well. When we start coming back up, we're going back to that medial dorsal cutaneous nerve of the superficial peroneal, and that's going to be innervating through to our medial hallux, but also into our lateral second and medial third toes. Now, in between those, of course, we have our deep peroneal nerve. As we know, quite deep as it comes down through our lower leg, and that's going to then, pass through with the dorsalis pedis at the ankle level, but then arise within that first interspace where it's providing its sensation there, and then through to our lateral hallux and our medial second toe. As we come along a little bit more medial again, we start talking about our saphenous nerve, and that's going to be coming down again reasonably deep, but really come through and wrap around that medial malleolus somewhat before further coming through into our proper medial aspect of the medial longitudinal arch. Now, one of my favorite nerves of the foot, the tibial nerve, that's going to be, obviously quite deep, coming down posterior to the medial malleolus, and just around that sort of high level of the medial malleolus or just above, it is going to bifurcate into our medial calcaneal nerves, as we can see, with some of their tributaries and communicators there. Now, our tibial nerve will then bifurcate into our medial plantar nerve and our lateral plantar nerve, with the lateral plantar nerve then arising our Baxter's nerve. And let's not forget that the Baxter's nerve does provide innervation through to that lateral aspect of the midfoot as well, which, some people do forget there too. Now, when we talk about that medial plantar nerve, that is going to provide plantar innervation through to the first, second, third toe, and the medial aspect of the fourth, whereas our lateral is then going to be talking about, that plantar fifth and the lateral aspect of the fourth there. Now, as we jump back into our dermatomes, again, really important to appreciate these. And I've got quite a few photos that are here so that you can have a bit of a closer look, and I encourage you to pause, have a bit of a further look and really see exactly where we're potentially getting innervation from, so that we can more appropriately diagnose and then treat. Because remember, we want to be treating up that length of the nerve as well as locally there. Now, again, this is a really great photo, and I really appreciate it, mainly because we've got that tibial nerve out on the lateral aspect of the foot, knowing that our Baxter's nerve actually innervates through to the abductor digiti minimi. And when we have Baxter's neuropathy, as you may know, we potentially can see some atrophy of the abductor digiti minimi. And so that's why, having a bit of a further look and understanding and seeing this in different ways is a really powerful option here. Okay, I really like this one because it shows the dorsal cutaneous nerves quite well as the plantar, cutaneous nerves, and I think really having a bit of a further understanding of where they are with respect to the bones is quite powerful. But then also we've got this fantastic sort of cut through just above the ankle, so that we have a bit of an idea of, okay, what's superficial? Where is it in relation to our other landmarks? You know, we're all very aware of our dorsalis pedis and our tibialis anterior tibial tendon. And you know, that's going to be a really nice landmark for our deep peroneal nerves. But then, you know, we know where our sural is, just posterior to the lateral malleolus. And so there's all these different landmarks that we have to have an understanding of, but then also to what depth. And so I really find that this is a great diagram for that. And then we go into something with a little bit more layered approach, you know, with some of our retinaculum, some of our tendons, and right up to the knee as well. And I think, you know, getting a bit of a greater understanding of where these, you know, nerves are coming from, that's what we're here for. And then something a little bit more all-inclusive here, showing a little bit more detail. And like I mentioned, jump back and forth, pause, you know, have a bit of a look at these images, because I do think that they're a really important and, you know, quite a friendly way for us to start going, okay, whereabouts are these nerves? And again, going back to the video, you can really see that, okay, well, yes, that tibial nerve is quite deep, and where is it originating from? And where am I able to target it as well? But this has been our lower limb neural anatomy. Let's have a bit of a further chat in our next session.